So what I'm going to get you to do is I'm going to get you to squeeze your knees together. Tell me if this side where you're getting the pain is sore. Okay, so squeeze as hard as you can.
Just there, just in there.
That's just pressure on there, but nothing coming down here.
No.
Right, tell me what's different if we go for two fists.
Same place.
Same
Same a
place.
little bit higher up, you would feel
Right.
more pressure.
And just relax, let me get the
sorry.
whole forearm in. Right, and now squeeze.
No pain at all.
No pain at all. Right, so the one fist is we're measuring one of the adductors, adductor brevis, two fists, adductor magnus, and then the full forearm, it's adductor longus. So it's a great way of differentiating
Longest.
between, exactly, yeah, it gets bigger each time. But most of your pain was actually over the tender spot here,
Yes.
not actually in the muscle group. So
No.
I'm kind of right off the fact your adductors are a problem. And I know that because the one with the full forearm, adductor longus, which is the most common, 80% of adductor strains are going to be adductor longus. So the fact you had pain on the other two, that would be something very, very out there. I'm not saying we see regularly. And I think it's more just to do with the fact there was pressure pain over the medial joint line. So I'm going to do a test for the ligament there instead. Just let your leg drop down. So we'll go straight first. Any problem there?
No.
Any
Oh, my ankle.
there? In your ankle?
Aye.
Alright. You're measuring the knee. So nothing in the knee there?
No.
No, that's just my hand knee. Okay. If we come further down here, any soreness there? No. So it's
Tender.
just
Tender.
tender in there?
No.
Up here?
Into there, yeah.
Joint
Yes.
line. Okay, let's just see what the wrist does. Any problem there?
Uncomfortable, but no pain.
Uncomfortable, no pain. Okay, that's pretty good news. As with all these tests, you want to do a few to differentiate. I think one positive test doesn't always tell us enough. So if we can do a few tests, it gives us a chance to differentiate between what's going on. So you've got joint line tenderness. Yeah.
It's tender when you're tapped.
But it's not a stress test against your actual ligament there. The adductors are looking pretty good to me. I don't think there's a major problem there. I suspect because of your altered gait through your foot and ankle surgery, what you're doing is just approximating, so bringing together the joint line there, but it's not really affecting the cartilage enough for me to worry about that, and today we don't really operate on them anyway. But what it's doing is you're just getting a little bit of tenderness on that joint line because of the way you're walking. Like say it's altered your gait through having the ankle surgery. And I think what we should do is look at the biomechanics a little bit, see if there's something we can do at the foot and ankle, maybe up at the back, see whether we can alter that. Is that alright?
That's fine with me.
So that'll sort your knee out. Now, this operated foot,
Yes.
we've been doing really, really well with this, had very few problems with it, but it's just started to cause you a bit of a catching feeling
Yes.
when you bring your toes up into that extreme position there.
That angle there, I've tried, yes.
Just there?
Yes.
Yeah?
It's very similar to the original pin before the operation.
Yeah.
Similar.
Okay.
But I've been stretching, I've been pulling up with like a belt,
Yeah.
and I've been on the wobble board a little bit, but not much.
Not too much.
It's
Does that
not
aggravate it at all or not?
No, because the wobble board's good because it goes like that.
Okay.
Mm-hmm.
Now you resist up, so you push your foot up against my hand. Does that cause you any pain?
Just a little bit in.
Right, so take it all the way up as high as you can. So you win. Well, keep going, keep going, keep
there.
going. In there. But if we come back a little bit, is that worse or not?
It's really uncomfortable.
Really uncomfortable. Now, no muscle activity at all. Does that hurt?
No.
Well, that's good, isn't it? No muscle activity at all. That's more of a
It's
stretch
just on the outside of it.
on the outside. So if we do that, that's less or more.
It's when you touch there.
When you touch it, okay, fine. It does seem to me to be more tender when the muscles themselves are actually working. Yeah, is that tender over there?
It is.
So what I'm going to do is just do some frictions there. Tell me when it's no longer tender. So it could take up to 2 minutes, sometimes it's really quick.
It feels nice and warm now.
Yeah? Is it tender where my fingers are still?
To be honest, I can't really feel my fingers, I can feel your thumb.
Right, because of my hand pushing your ankle, yeah. But they're
That's fine.
nice and easy, okay? So bring your foot up again, you win, bring it up. Is that any easier?
No, that clicked.
I heard it click, yeah. But in terms of the pain there, forget the click.
It kind of a little bit painful when it clicked.
Yeah, but apart from the click,
No.
it wasn't as painful as
No.
before. No? Try it again then, because the click's happened. You win again, bring it up, keep going.
That seems totally different now.
Totally different, yeah.
Right.
So it's that tendon. So all I've done is just shocked it, given you a bit of a nerve response.
In all fairness, when you were pressing the airport, it just seemed to be in there where I feel it, but
Yeah.
not pressing there.
Yeah. I think what we've got is well, the ankle joint itself, two major joints, and the top joint is the one that causes the problem. I want to try and adjust that. But I think what you've got is a bit of a tendinopathy, so the two tendons here and here are a little bit inflamed, a little bit unhappy, because I can stimulate them, which just kind of switches off your brain response to it, get you to do the same action, it doesn't hurt anymore. So with a longer treatment through here, exercise plan to get those to respond appropriately to the strength and conditioning, I think you'll end up with that not being a problem. We can resolve this as well. Yeah, but we might need to think about just reviewing the insoles at some point.
Yeah, because I get the insoles and I'm going through them really fast.
But we might have to review them and get something a bit more bespoke. Because you're starting to walk outside with this version C and straight on with that one. And we're just going to start pushing other problems further up the body and into the future. So we might just do a full biomechanics review with you once we get these painful bits under wraps. Yeah?
Yeah.
Alright, let's crack on.